Good day everyone, my name is Gidget Shainti Soliman, a first-year nursing college student that will perform a return demo about the lower extremities. Before starting the procedure, always introduce yourself first to the client, explain what are you going to do, why is it necessary, and how can she participate. So, good day ma'am, my name is Gidget Soliman and I'm your student nurse for today. Perform hand hygiene before starting the procedure and touching your patient. Next is, I'm providing my client privacy so that she will not feel embarrassed during our examination. Procedures. Expose the legs of your client. Check the legs and feet for any skin lesions, skin turgor, varicosities, lesions, edema, swelling, and discoloration, scars, rashes, and temperature and muscle mass. And as you can see, my patient has scars due to her playing outside. Next is palpate the hips, the thighs, the patella, the popliteal pulse, the calves, the Achilles tendon, the calcaneus, the lateral and the medial malleoli, the posterior tibial pulse, the dorsalis pedis pulse, the metatarsals, and the toes of your patient. And perform the lunge test. Next is change the range of motion of the legs. Ask your client to raise her leg at a 90-degree position. Then back down. Next is perform the following on the leg. Abduction, adduction, flexion, extension, external rotation, internal rotation, and the patrix. Next is perform it again on the other leg. Abduction, adduction, flexion, extension, external rotation, internal rotation, and the patrix. So, ma'am, do you feel any pain? Okay, thank you. Now, we are going to test the client's legs against resistance. With the client in supine position, ask the client to raise one leg. As you push down, resistance. Next is, have the client lift the same leg up. As you push up and she push down against the resistance of the hand. Next is, have the client flex the same leg, place your hand on the client's foot, and try to pull as your clients pull her feet. Next is, place your hand on the sole of the foot and push while the client attempts to push your hands away. Resistance. Repeat with the other leg. Ask the client to sit at the edge of the examination table. with the knee flex at a 90 degree with the knee flexed at a 90-degree angle. Place your hands on the upper thigh and ask your patient to resist against resistance. Thank you, ma'am. Next is put your hands on the lower thigh and ask your client to resist against resistance. Thank you, ma'am. Next is have your client lift the leg as she resists against resistance. Okay, lift your leg, ma'am. Now, place your hands under the client's thigh and ask her to resist against resistance. Please resist. Perform it on the other leg. Can you please put the hands on the upper thigh as your client resists against resistance? Thank you, ma'am. Then, under the thigh, as your client moves against resistance. Thank you. Next is lift your leg against resistance. Lift. Thank you. Then under the legs. Thank you. Check the range of motion of the feet. Ask your client to do what you perform on their feet. First is the dorsiflexion and the plantar flexion. Can you do it, ma'am? Next is ask the client to perform external and internal rotation. Can you do it, ma'am? And last is extension and flexion of the toes. Can you do it, ma'am? Perform the same procedure on the other feet. First is the dorsiflexion and the plantar flexion. Do it, ma'am. Next is the external and internal flexion, rotation. Last is the extension and flexion of the toes. Check the feet against resistance. Place the both hands on the feet of the patient and ask the client to please dorsiflex them against resistance. Dorsiflex. Now, place your both hands on the soles of the feet and ask your client to plantar flex it against resistance. Last is check for the symmetry of the iliac crest. Remove the cover of your client. Next is have your client sit on the examination table or the bed. Check the range of motion of the hips. First is forward, backward, to the side, and twist. Like this, ma'am. And the other side. Last is adduct and adduct your client's hips. Perform the same procedure on the other